Hello everyone. So today we are going to talk about or going to discuss a couple of CAOP related MCQs from the topic of antidiarrheals and a few from laxatives. So let's start with question number 1. A patient with moderate renal impairment is seeking a bulking agent for constipation. Constipation and using bulking agent, psyllium and metamucil, these kind of things. Which of the following is the most important clinical consideration for this patient? Option A: bulking agent are contraindicated in all stages of renal failure. Option B: renal impairment increases the risk of anaphylactic shock from xylem. Option C: the fluid volume required for administration may be unacceptable. Or option D: the potential for systemic absorption of the bulking agent. So we will break down all the options. Bulking agents are contraindicated in all stages of renal failure. I don't think so. It is true, but okay. Renal impairment increases the risk of anaphylactic shock. So anaphylactic shock from psyllium is very rare. Fluid volume required for administration may be unacceptable. This is a point actually that can matter in case of renal impairment. The last option, the potential for systemic absorption. There is no systemic absorption of the bulking agent, so I think it's C. Yes, it is. Methylnaltrexone, that is mu receptor antagonist, is specifically indicated for opioid-induced constipation in palliative care. What is its primary advantage over traditional opioid analgesics? Option A: it blocks peripheral mu receptors without antagonizing central analgesia. This is correct option because it does not cross blood-brain barrier to overcome the analgesic effect of opioid. It enhances the no. It can be used as a standalone treatment for chronic idiopathic constipation. It has a high ability to cross. No, not at all. So it's option A. Regarding the use of loperamide in children, which statement aligns with the practice points provided in the clinical guidelines? Loperamide in children. It is the first line. No, not at all. It is used to treat. No. It should only be used for chronic diarrhea under specialist supervision. So this is correct answer. Exactly. A patient is prescribed diphenoxylate with atropine. What is the clinical purpose of adding atropine to this formulation? Well, atropine is added with the diphenoxylate, and both are used to treat diarrhea. But atropine's main action is to overcome the risk of dependence. So, to discourage the misuse and potential addiction of the opioid component is the right answer. When administering methylnaltrexone to a patient with a creatinine clearance of less than 30 ml per minute, how should the dose be adjusted? No dose adjustment? No, we have to adjust dose. The dose should be double to ensure efficacy? No, dose should be halved. Yes. Which of the following is a potential rare but serious complication of using opioid antidiarrheals in patients with severe ulcerative colitis? So it can cause toxic megacolon, that is decreasing motility in the presence of severe inflammation like ulcerative colitis, and it can precipitate toxic megacolon. What is the maximum daily dose of codeine when used for the short-term treatment of diarrhea in adults? Is it 60 milligram, 480 milligram, 120, or 240? I'm not sure about it, but I think it's 120. See, the single dose is 3 to 60 milligram, 3 to 4 times daily. What could be? Okay, so for example, if it is 60 milligram, 60 into 30. So it will be, I think it's 120 milligram, but I'm not sure about it. It can be 242. Mm-hmm. Okay, let me go for 100. 100. Oh, it's 240. First wrong question. Wrong answer. Why are adsorbent antidiarrheals like choline and pectin generally not recommended in modern clinical practice? Because they are no more effective as compared to placebo. A patient is taking loperamide for chemotherapy-induced diarrhea like fluorouracil. What is the maximum duration they should use this medication for this specific? So it's 24 hours maximum duration. Mm, oh, sorry, on alternate days, so it's 48 hours. Yes, it is. Next question is last, and I am about to make 90% result. When counseling a patient on the use of oral rehydration salts, which of the following is a key practice point regarding temperature and tolerability? Well, ice blocks of ORS dissolved solution are preferred actually. So solutions may be better tolerated if frozen and presented as an ice blocks. So this was all about today's topic, that's antidiarrheals and specialist laxative. It was quite simple as compared to previous topics. Thank you so much for watching. Make sure to subscribe so that we will keep on discussing interesting MCQs related to pharmacy practice.